Hi everyone.
I'm Midwife Leslie, joined by Midwife Karen, and we are midwives at My Expert Midwife. And we'd like to talk to you a little bit about your perineum. So we know that during a vaginal childbirth, over 80% of women will have some kind of cut or tear to their perineum.
Yes, and what we want to talk about today is how you can protect your perineum, not just during pregnancy, but how you can protect your perineum during labour and birth, and postnatally as well, how to care for your perineum. So we'll start with pregnancy.
So in pregnancy there's actually quite a lot you can do, and I think if we start with exercise and Pilates or yoga, where you're actually protecting your core, you're strengthening your core, and with doing that you're also strengthening your pelvic floor muscles, the muscles around your hip and your pelvis, and that in itself, just exercising your pelvic floor regularly helps massively with just getting blood flow to that area.
And keeping the strength as well, because you've got to remember that your hormones change so much, don't they? So everything's more relaxed in that area. So building that bit of strength back up is really helpful to your pelvic floor as well.
And then from 34 weeks of pregnancy, you can do something called perineal massage. Now we do have a video over on our Instagram channel and our YouTube channel that shows you how to do it. But we just wanted to talk a little bit about perineal massage and why it's so effective and the evidence behind it. So, Karen, I think from my point of view as a midwife, we saw women giving birth, and you could always tell the difference between a perineum that stretched when someone had already had a vaginal birth, and the difference between that and someone that hadn't given birth before. And if we look at perineal massage, it's almost designed to replicate the stretching that first baby has done.
Yeah.
So can you take us through the benefits that you found in your research into perineal massage?
Yeah, I think that when you're talking about being a practicing midwife and seeing what you're describing, the stretching, the tissues are just so much more elastic, aren't they?
Yeah.
It's that muscle there, isn't it? And it's quite, it's quite thick on the perineum and quite muscular, and it's just helping that to become a little bit softer and a little bit more stretchy. I think also what we don't recognise about perineal massage is that women can get to know their bodies a little bit better than, what we think that we know our bodies, but really, we don't really go around touching a lot down there or stretching and things. And once you get to know what that muscle is down there, how it feels, how thick it is, and how it feels when it actually stretches. Because when you have your first baby vaginally and you feel that stretch, it can be really quite stingy, stretchy, and a little bit overpowering. But if you've been doing the perineal massage and doing it regularly, you'll be used to that feeling, and that feeling will just become a little bit more normal when your baby's head starts to stretch down there. And I mean, that stretching is just for just a short amount of time as your baby's head, makes the opening wider on your perineum to be born. But it's that feeling and knowing that that's normal.
Yes.
Yeah.
And I think that's the big thing for women when they're giving birth, is that understanding that that's what their bodies are designed to do. And if they've felt that sensation before, they've got that reassurance that their body is doing what it was designed to do. And I think as well, you can do the perineal massage yourself, but you can also get your partner to do it. And I think sometimes there's a reticence for women to ask them to do something that's intimate, that's not connected with sex.
Yeah, absolutely. But I think most partners really want to be involved in helping in some way.
That's it.
And this is something really helpful that they can be involved in. And, you can make it, into part of, your relaxation during, having a bath, and then maybe thinking, right, well, we've got to, get to this and do it, and just, be determined to kind of build it into your routine a little bit towards the end of pregnancy.
And when we've looked at the research into perineal massage, what we find is, and there's lots of different studies that have been done, but overall what we find is, for your first vaginal birth, it reduces your chances of needing an episiotomy. And when we look at recovery from episiotomy, they've actually got a higher rate of infection. So you're more likely to have an infection with an episiotomy than you would do with a tear. So again, it's, if you can, to try and avoid that episiotomy, perineal massage is a great tool to have in your box.
Yeah. So protecting your perineum during birth, I think that people think that once they've done the perineal massage, that's kind of the end of it, but there's so much that you can do, isn't there, for birth, that will help to protect your perineum and make sure that you're doing the best that you can to reduce that trauma to your perineum, because there's all sorts of different positions you can use, and we know that certain positions will protect your perineum more, and being upright and mobile is definitely one of them. I mean, the amount of births that I've been to and seen as a midwife, absolutely unbelievable how much more controlled women are when they're upright.
Absolutely.
And, you know, having that, you know, not just the control themselves, but being gently guided by their midwife if they need that guidance as well. And again, going back to the pregnancy and knowing your body,
that's it.
Being able to feel that baby descending and coming down, and your perineum stretching, and that's all part of the preparation for labour and birth. Now, you could be upright and standing, you can be on all fours, kneeling up over the bed. There's all sorts of different positions.
And I think that upright position, and this is probably something that people don't quite connect with, is when you're upright and you're mobile, your baby's head is actually pressing down on your pelvic floor and is being forced to tuck in, and it's tucking your baby's head in or encouraging your baby's head to tuck in. It makes that diameter that's actually coming out as small as possible, and if your baby's head's as small as possible, the amount of stretching that your perineum's got to do is as little as possible. And I think when we look at babies that are maybe back to back, where their heads are slightly tipped, then obviously that is making that room that your vagina and that your perineum has got to make a lot larger. So just being upright helps your baby into that best position possible for birth.
Because the baby gets their chin really well tucked in, doesn't it, when you've got a more upright position like that to come through the pelvis.
And it helps the babies to turn as well. So if they are back to back, it encourages them actually to help to turn. We do have some women though that will say, well, I'm exhausted, you know, I just want to have a lie down. Or you may decide that for you, an epidural's the way to go for managing your pain relief in labour. And I think it's important to note that there's, you know, the research that's been done on positions for pushing and giving birth, and there's loads and loads of this research, actually finds that being on your left side lying down, but on your left side or your right side, reduces your risk of tearing as well. So
yeah, absolutely. And you can get support, can't you, from your midwife during birth. So don't be shy about coming forward and asking for you know, equipment or help in order for you to have that sideline position. So it can be all too easy just to be there sat on the bed and you're pain free now because you've got your epidural in and everything, but you still need to be thinking about doing something.
that's it.
And they've got things called peanut balls, haven't they?
Yes, I was going to say that.
Basically they're like a gym ball in like what a gym ball is, but they're like a peanut and they're shaped like that, and your leg would go comfortably in the middle of it.
Yeah.
So then that would open your pelvis up to give your pelvis that little bit more room.
And again, you're letting your body do as much as possible to get your baby's head into that nice, safe birthing position. And I think just having that comfort as well when you're lying on your side, of knowing that even though you've got your epidural, you're doing as much as you possibly can to help get your baby into that good position, that head tucked in position for giving birth. And then I suppose that takes us then on to pushing and different types of pushing. And I think there's a lot of confusion around what we as midwives call active pushing and coached pushing. So I think if we talk about active pushing, so when we as midwives talk about active pushing, what we mean is when the woman has utterly no control over her body. So her body makes her push, and these are these massive big abdominal muscles now that are working, and they're the same abdominal muscles that make you vomit. So if you think about the control that you have and the force that you have if you're vomiting, you know, you times that by 10 for the force and the lack of control that you actually have. So there's not really a great deal that can stop a woman from pushing when she's got an overwhelming urge to push, or is what we midwives call active pushing.
Well, it's involuntary, isn't it?
That's it.
It's actually called involuntary pushing, so you can't help it. You can try and breathe through it for a certain amount of time, but in the end your body will normally take over and want to bear down, won't it? Not in all cases, because you've got to remember, you don't know what it's going to be like for you, do you, giving birth? You might be somebody that can just breathe through it and breathe your baby out. That's not common if you've had one baby or more beforehand, but for a first baby, usually the involuntary pushing,
that's it.
It just takes over, doesn't it? I'm even doing it now.
And it's amazing to see as a midwife to watch women transition from that point where their cervix is sort of fully dilated, it's completely gone, and these big abdominal muscles are now taking over, and the noise changes as well as this, you know, this mum to be is moving into that point where she's actually starting to push her baby down birth canal. But you know, if you think about the pelvis, it's quite, you know, it's bony, it moves. It's 3 bones that are joined together by ligaments, so there is movement there, but there's still a lot of adaptation that your body has to make, so a lot of force that has to happen. So please don't confuse the active pushing with coached pushing. Coached pushing is what we all sort of dislike, don't we?
Yeah, because it's forced pushing, and sometimes you need a little bit of help from your midwife, especially if you've got a dense epidural block. You might need a little bit of help from her to kind of like get the baby to, you know, push it out, because you won't have those natural feelings of your body telling you to do that, because that's been taken away by the epidural. So that's when the coach pushing might be seen more often, but there is no place in, you know, a birth that is normal, you know, and where you don't have much anaesthesia going on, that where you would need that coach pushing to happen. And as that baby descends, you can see from the outside, can't you? You can start to see all the tissues start to bulge.
It is amazing, isn't it?
It is fantastic, yeah. And you know, you know that birth is imminent, and you know you're with that woman, helping her to, you know, be guided. You know, she might be guiding herself, absolutely, but she often looks to you, doesn't she? You're her midwife, to give her a little bit of guidance, and you know, talking through the birth really as she comes up to crowning. So when it comes to the birth and crowning, this is the important part where you need to not just listen to your body, but you need to listen to your midwife if she's there as well, just so you can have a really slow delivery of that head. That's what's important about protecting your perineum. So you don't want your baby just to suddenly basically shoot out. You want it to come as slow as possible. Get those tissues to stretch as slowly as possible. I think also, you know, you've got to remember that if you're in the water as well, that nobody will be touching your baby at this point. And the water does really soften the tissues too, doesn't it?
And then you've got that pressure as well of that body of water that's actually helping to just control how quickly this baby head comes.
And the warmth of the water, I think, which I think leads us straight into the warm compress. Loads of research behind this, isn't there, to say that it's really effective for reducing perineal trauma.
And it's strange because we don't see it that often.
No.
You know, we used to. My mum was a midwife, and that's what they did. They're warm basin of water, their swabs, and then, you know, that warm water on the perineum as well. And now that we've got this huge body of evidence that says it really does help to reduce tears, what we wanted to do was just sort of talk through how it might actually seem as your midwife's doing it. Now, they would have something probably as big as this, because the larger surface area you've got, the more it holds that water temperature. And they would probably have their swab folded.
And I think you need to if you want this at your birth, you need to ask for this,
Yeah.
don't you? So write it into your birth plan, you know, and say, this is what I want, you know, I want this warm compress, I think it's going to help me, I think it's going to help protect my perineum as well.
And this can be done in any position that you give birth in. So it doesn't matter if you're standing or kneeling or on all fours or on your left side, right side, or any position. Doesn't matter at all. So if you imagine this is your perineum, all your midwife would do is make sure that this is the correct temperature. And remember, your baby's head is there, so there will be some direct heat. So we have to be careful that it's not hot. And all your midwife would do is place the compress or the swab or the pad, whatever it is that they're using, on your perineum. And this helps as well with that stretching, that sort of burning sensation that you get.
Yes, and it just is a lot more comfortable, women say, isn't it?
And then obviously your contractions are coming in waves or surges. So as that happens, your baby's head's coming down, stretching the perineum, but then releasing as well. So you've not got a constant stretch at the start. It sort of gives and then comes back and then gives and then comes back. And then very slowly, your baby's head is able to clear your perineum and is born. And it's that use of that compress that just helps to soften these tissues in much the same way.
And that's the hard bit, because that's the all bone bit, isn't it?
Yeah.
That stretch the perineum there. But I think we also have to be aware of the fact that the baby then normally does a little turn, restitutes like that, and it's about supporting this baby, its head and shoulder afterwards. If you can ask, I mean, if you're in an upright position,
Does it automatically?
does it
That's
automatic? It's that's why upright positions are so good for protecting your perineum, because what will happen normally is your baby's shoulder will just gently come itself and stretch the perineum and release itself. Whereas if you were on a bed, like laid in a semi-recumbent position like this, then you almost have to deliver one of the shoulders, what we call the anterior shoulder, and then that digs that bottom bit in
That's
a
it.
little bit, doesn't
Right
it?
onto the perineum
Yeah.
as well, just onto that piece of tissue that you want to avoid any additional pressure onto now.
So again, you can see how that would work about the position that we talked about with epidurals. So the left lateral, so lying on your side. So that clears gives your perineum clearance, what I call
That's it.
clearance. There's nothing in the way of it then. And then the baby's shoulder can come easier and is less likely to do damage.
And I think as midwives, we get to see when we have, those births where we don't do anything, we don't touch, such as water on all fours. You can see it's actually that top shoulder that actually clears your vagina and your perineum first.
Yeah.
So having this shoulder that's at the bottom, that's closest to your perineum, is actually the one that comes out second. And that again is nature's way. It's designed to help to protect your perineum as well. But in the days when we were taught how to manage a birth, we were always taught it's
Absolutely, but I think that's the beauty of the upright birth, isn't it, and the water birth, in helping to protect the perineum.
So this posterior shoulder, if you're upright and mobile, this one is actually the first one to clear. So it's not putting added pressure by expecting or forcing this top one to come away. So again, just the benefits of being upright. And letting your baby come out on their own. And even if you're on your left side, a lot of midwives, when it comes to the shoulders, will just press the mattress out the way so that it allows space for the baby's shoulders to clear as well.
So I think the key points for protecting your perineum in labour are that you avoid the active pushing, if at all
Or
possible.
the coached pushing.
The coach pushing, that's what I meant, yeah. So the coach pushing. So forcing your pushing, and just listen to your body, and also have a warm compress.
Yes, definitely.
Use the water during labour, and make sure that if you are on your back for any reason with an epidural, that you use that sideline position.
And a peanut ball if you've got them. If not, just plenty of pillows in between your knees are also
Absolutely.
quite good.
Yeah.
Brilliant. So you've given birth, but at actually, the work doesn't stop there. So you may still have sustained maybe a tear or a graze to your perineum, or maybe even an episiotomy, and it's important that you look after this so that you can recover as quickly as possible and reduce any chances of infection.
Yeah, totally. And I think that hygiene is key at this point. And I think we need to remember that, you know, this is a wound down there. So, you know, if you say, for instance, you had a cesarean section, you would care for that wound. You need to care for this wound as well. And even if things are just a little bit sore and you don't have a tear down there, you know, you just need to give yourself a little bit of TLC to recover, basically. It's a recovery period, it's a postnatal period. So hygiene, you need to be changing pads really regularly, you know, because once a pad's like sat there and, you know, you've got your lochia, your blood loss on it, then, you know, it can sit there and then bacteria can breed on it. So make sure you're changing them at least 4 hourly to make sure that, you know, you don't get that, you know, environment where bacteria can breed.
Yes.
And when you do go to the toilet, you know, make sure that you wash your hands before as well as after. I think people don't realise that you've been dealing with a baby and pooing nappies and doing all sorts as a new mum, haven't you? And then you go into the bathroom and you're dealing with your, you know, potentially your wound on your perineum or your sore perineum, and you need to have clean hands in order to do that. So make sure your hands are clean before as well as afterwards. Make sure you're regularly changing your pads too.
And I think as well, it's important to understand that your urine is sterile, so they're, well, normally, unless you've got an infection in your urine, but it's not got any bugs in it. And we're always taught to wipe from the front to the back, so that if you've had a bowel movement at all, but you've had a wee at the same time, that you can use that urine that's sterile, that's clean, to actually wipe your back passage. What you want to avoid is going the opposite way, where you're actually taking the contamination from your poo and transferring it onto your perineum. So going the opposite way, front to back, helps just to keep your perineum clean. And it's about keeping your perineum clean. It doesn't need to be dry. We hear this a lot, people using hair dryers and things. It's a moist environment that's actually best for wound healing, and you've got a lot of blood loss anyway, so please don't use hair dryers. We know that they actually do the opposite. They can help to introduce an infection. You just need to pat the wound bed dry. If you've been in the bath or you've had a shower and it's wet, just pat it dry with a clean towel or toilet paper, but don't be tempted to absolutely have it bone dry. It's just almost impossible with a wound that's has, you know, that sort of blood loss around it and things like that as well.
Yeah, and I think cleaning your perineum, you know, so giving it a wash or a bath or a shower, you know, twice a day, or more often if you wanted to, if you felt like you needed to at all.
And essential oils are fantastic, not only for the healing process, but also for keeping your wound bed clean. And we know that there's essential oils that have actually been shown to have antibacterial properties, such as tea tree oil. And we now have NHS hospitals and postnatal clinics that are actually putting together essential oil blends. Midwives are actually putting them together for women to use afterwards, even during labour as well, to relax them. But I think it's important that we understand it's not just about water, although that's brilliant to clean, that you can use essential oils as well, and they're great for pain relief. Lavender, you know, when you're bathing a bit of tea tree mixed with milk, is fabulous.
Witch hazel and arnica, you know, to help inflammation, reduce the inflammation.
And then pelvic floor exercises again. We sound obsessed with pelvic floor exercises.
Yeah, I mean, obviously, you know, once you've given birth, you might not be fancying doing pelvic floor exercises like you were when you were pregnant, because you want to, you know, be recovering and having a little bit of a rest and recovery during that period. So start to do them as soon as you feel like physically able, but don't feel like you've got to go straight back into it like you were before. Build them up gently, you know, because if you have had a tear or an episiotomy down there, then you'll want to really take it slowly and build up that intensity as you go along. There's apps that you can use.
I was just going to say, there was one called Squeezy, that's an NHS physio app, and it actually alerts you I mean, it would probably drive you mad actually, but it alerts you that you need to do your pelvic floor exercises again. And it's great as well if you've got a watch, like an Apple Watch or something like that, because it can connect. So these are our top tips for perineal care and recovering. I hope you've enjoyed it. Thank you for watching.
Thank you.